Hello, ladies and gentlemen. Welcome to another video at the Pharmacist Academy. Woo! So I know it's around the time of the year where residency interviews are going out. So for some of you, you've been on one or two interviews already, and for others, you haven't been on your first one. So I'm so glad that I put this video out at the right time. So this will focus on certain tips and recommendations for anybody that's going to a pharmacy residency interview. As you guys know, I'm a PGY2 oncology resident, so I've been on both sides of the fence. So at one point, I was in the same shoes as you, where I was going to a residency interview. And during my PGY1, I got a chance to evaluate other candidates who are coming in for the PGY1 position. So I've seen both sides. So I came up with these tips and I really hope it helps you. Matter of fact, it will help you. Trust me, after this video, you're going to feel so much more confident. So let's go. First of all, I just want to say congrats. Woo! Okay, so you got an interview, right? Very proud of you because a lot of people don't even get interviews. So you actually you stood out, right? You did a great job with your application process and you put in the grind during pharmacy school, so good job. But unfortunately, that's only a small piece of the whole pie. You see, no matter how good you look on paper, if you go to an interview and you can't present yourself very well, you're not going to get the position. Okay, so it doesn't matter. So preparation is key. So please, if you need to take notes during this video, please do because it's going to be very helpful. So today I have four objectives for you guys. So the first one is what to expect. That's a very general topic that I'm going to go over. The second, preparation before the interview. Now, keep in mind that you cannot control everything, right? You cannot control who the director is going to match at the end of, let's say, the matching process. You can't control that. What you can control is your preparation before the interview. So, objective number two is very important. Number three, interview day. You know what to do during the interview day, like how to talk to the other candidates, how to talk to the clinical staff, how to come in prepared, what you should bring. That's what I'm gonna talk about for that specific objectives. And four, post interview. What to expect. Now the interview setup is it varies by site. So everything that I share with you guys, it may not apply to the site that you're going to, but a lot of these are like general things that each site has or look for in a candidate. So this video is still going to be helpful. Keep in mind that other candidates will also be interviewing with you. But trust me, this is actually a benefit because some of these candidates, one, they've been to other interviews. Okay, so they have experience. They may seem more nervous. So it's going to be really good for you if you can make small talk with them and also ask for tips. All right, ask for tips on certain things they asked during their interview, their previous interviews. You never know, it might help you. Also, take their business card because that's the perfect time for you to network. Okay, you two are in the same situation, or you three, or however many there is at the interview site in that specific day or time. All right, so take the business card for networking purposes. You never know. There's going to be different clinical staff that's going to interview you. It may be one on one, all right? It may be two people interviewing you, or three people interviewing you at once, or even four. It depends, once again, on the site. It could also be a group interview. I had to experience that where I was in the conference room and there was a round table, and there was about six clinical staff members, if not more, probably eight. And they were just there asking me random questions. They were just throwing questions at me and they were all just looking. So yeah, it gets pretty intense when they put the interview together like that. So like I said, the that you going to do it depends, right? So the director of the program, when you do the interview with them, that one is usually one on one. Keep in mind that the director of the program is the person that does the matches. They are usually the person who selects the match order, right? Whether to rank you as number one, number two, number three, and so forth. Okay, so that's the part you want to definitely make sure you bring your A game. You may also interview with the preceptors and the current residents also. More about what to expect. Now, what type of questions would they ask you? I can't really pick out specific questions, but like if you Google questions like pharmacy residency interview questions, you're gonna get a ton of questions, okay? But here are some examples that they might ask. Your strengths, of course, you should always know your strengths. And always talk about, like at the interview, for example, talk about how your strengths are going to help you, achieve success in that residency. Or if you talk about your weaknesses, talk about how the residency program is going to help you turn your weaknesses into strengths. So for me, I said that, during rotations, I used to see a lot of residents do presentations, and presenting in front of a group of people is something I always wanted to improve in. So another one of the reasons why I decided to go for a residency is because I wanted to improve my presentation skills. It seems so simple, right? But literally that's what I want, and that's what a residency is going to provide you with, that kind of strength. You must know your greatest accomplishment, how you stand out compared to other candidates. They ask this majority of the times. I've asked other people who went to residency interviews and they've asked them this. So come up with a good answer. Questions about your CV. Whatever you put on your CV, make sure you know it in and out. Okay? Because they could simply pick up your CV and start asking you questions from there. So look at your experiences and how each experience affected you. List the skills that you developed from each experience, and let's say things that you could do, you things you would have done differently if you would have, re-experienced it. Okay? They might ask you clinical questions. There's no way to prepare for this, to be honest. It's not like you're gonna go study the RX prep book, right, before your interview. You know, they might ask you anything. Okay, so I mean, for that, I can't really I can't really help you guys with that. Just hope it's not a very difficult question. Like for me, they asked. I remember one of them asked me, what kind of medications you would avoid if a patient has serotonin, if a patient is at risk of serotonin syndrome, right? So that wasn't so bad. They might ask you about your availability, maybe working on weekends, being on call, coming in a little earlier, handling feedback. All right, they might ask you questions about this, and this is actually good. It's good that if they ask you questions about your feedback, it's the perfect time for you to sell yourself. Show them, prove to them that you love feedback. Okay, you love feedback, and that's why you're doing a residency, because you want to get feedback to help you improve as a clinician. Okay, and they might ask you questions about being able to work with others. Some sites may require you to do a presentation, a clinical case, or they just might ask you a bunch of clinical questions. For me, I had to do a presentation. And for me, the presentation, I had to select my own topic, but depending on the site, they might send you the topic that they want you to do the presentation on. Now, if you choose a topic, this is my personal recommendation, okay? Try to pick something that stands out. I mean, from my experience, I've seen a lot of candidates do like clinical presentations, maybe on a disease state or a side effect, but try to stand out, because if you stand out, they're going to remember your presentation. When I was doing my interview for residency, I actually applied to two sites and I got interviews at both sites. But what I from just those two interviews, I would say three people presented on on actually it was two. Two presented on the overuse of proton pump inhibitors. Okay, so I mean that was like a very common topic apparently, because I've asked other residents. So you want to try to stand out the box. What I did was that I presented on the role of the pharmacist in transitions of care. All right, it's very different, right? You could present on USB 800. That's a hot topic right now. You know how to be prepared for USB 800, or how to pass Joint Commission next year for USB 800, something like that. Population health is a hot topic in pharmacy. Look it up. It's a very hot topic. The opioid epidemic, right? That's a good topic for you to present also. And with that, you could discuss how you plan on utilizing the institution's resources to help, deal with opioid epidemic and to prevent the overprescribing of these opioids in that institution, something like that. Because then now you're bringing them solutions, like you're coming in. You know how they say don't ask what your country would do for you, right? What Ask what you could do for your country. Ask what you could do for the hospital. No, you should not ask, but say, right? Like say what you could do for the hospital. Improving patients' satisfaction scores. So they have different satisfaction scores or different things that they look at to kind of get an idea of how a hospital is operating. And this affects the amount of money that the hospital may get. So hospitals take that very serious. So look into that. There may be certain things that you might, catch an idea and do a presentation on. Just a idea I threw in here. You never know. Dealing with medication shortages, that's one of the hottest topics right now in pharmacy. It was really hot last year, but I feel like it's still kind of hot. It didn't burn out yet. So look into that. That's also a recommendation. More of what to expect. They may ask you scenario based questions. For example, what would you do if you came to work one day and there was no ready to use cold trays, sick call? There was a sick call, nurse complaining about missing medication, and an employee waiting for a flu shot. Like which one would you take care of first? Okay, this is just an example, but no matter which one, no matter what kind of scenario based question they ask you, if you could provide patient care first, make sure you always say that you will do that first. Okay? And the other things, it really depends. Everybody will have their own answer. But patient care is always first, and safety. Okay? Tour. They will take you on a tour. This is usually, it depends. Like I said, depends on the site. Some sites do this towards the end of the interview. For some sites, it may be in the beginning. Okay, so it really depends. And it's usually given by the current residents. But as you can see here in the second bullet, I said remain professional because let's be honest, the residents, like me talking to a resident, I'm not that nervous compared to talking to the director or another clinical pharmacist, right? So the residents will make you feel a little bit more comfortable, some of them, but still remain professional, okay? And this is the perfect time for you to ask questions. So during the tour, you can ask them questions about, which clinical pharmacist works on this floor, right? Or the number of beds on this unit and the role of the pharmacist on this unit. Are there any satellite pharmacies? Are there any clinics around here? Those kind of questions. Preparation before the interview. This is the most important aspect of this whole residency interview, your preparation before. This is the only thing you could really control. You can't control a lot of things, but the things that you can control, you must master them, okay? Do your research on the site, all right? Check to see if the hospital has any awards, all right? What kind of patient population do they serve? What's the affiliation with medical school and pharmacy schools? What is the hospital known for? Just try to gather some information about the hospital, and perhaps once when you're answering the interview questions, you could bring these things up because it just makes you look good, and it showed that you did your research on this hospital, which means that you actually want to come here. Okay. Do your research on the clinical staff. Some of these clinical staff members may have publications. They may be members of a specific organization, so you could make that connection with them. They might have awards. Okay, search to see their role in the hospital. If there's anything, you can ask, students who are doing rotations there and whatnot. Faculty at a pharmacy school. If you could find that out, that's also good to know. Review your CV and letter of intent. Once again, your CV, everything on it is fair game. Everything on your letter of intent is fair game. So make sure you know what you wrote on these two things. Practice interview questions. I'm going to say it again. Practice interview questions. When I was preparing for my residency interview, I practiced over 100 questions. I had an answer for each question. Okay? It's not about faking it to making it, it's just perfection, right? This is a big deal. Remember, at the interview is where it goes down. So you just want to make sure you give it all. You give it your all. Okay? So practice interview questions. You can Google these interview questions. Try to answer each one. All right? Go through them. You don't even need to type up the answer, but have an answer and practice that. Right? You don't need to go over 100 questions at once. You could do 20 a day. You could do 10 a day. Right? It doesn't have to be the whole 100. 50 questions. 20 something questions. Practice some interview questions. Practice it in front of the mirror if possible while you're standing up. Okay? And this last one is a little weird, but yes, I did this. I Googled the program director and I got a picture of her. So I put it on my laptop screen and I just started answering the interview questions. I started practicing my interview questions while looking directly into her eyes. That remember, like I said, the interview with the director is one-on-one, and that's the most important person during that whole thing, right? So you want to make sure you bring your A game. So that's what I did, and when it happened in real life and I was doing it right in front of her, I wasn't nervous at all, to be honest. I wasn't nervous because I practiced in front of her several times. Write down questions to ask at the interview. Okay? So I recommend that you bring a notebook, a little notebook, and ask and write down these questions. And it's totally okay. Right? It's totally okay to have this notebook with your questions in. These are some random questions I put here, but ask about how often you would get feedback from a preceptor. Please, if they don't bring this up during the interview, ask them. All right? It just makes you look so good. It just shows that you're ready to learn. Okay? That you understand that you're still a student with a little bit more experience, but you're still a learner. You're a lifelong learner. Okay? So accepting feedback is something that you want. So just show them that. You can ask about opportunity to teach or precept students, presentations that you have to do, and how often. You could ask them, and then you could just say, I'm asking because, I really enjoy doing presentations. I want to improve. I want to improve in that particular thing. Because what's the point of knowing the information if you can't present it to other people, right? Providing in service or educating for the pharmacy staff. Ask them how receptive are the physicians, to pharmacy's recommendation. You know, Google more questions. It doesn't get easier than that, right? On the interview day, it doesn't matter. Listen to me. On your interview day, it doesn't matter. If you prepared before that day, you will be fine. Do not stress it. Stress it if you are not prepared. But if you practice those interview questions over and over and over again, you will be okay. All right? Then go in and just do your thing. Remember, the worst case scenario is that you're still a pharmacist, okay? And that's probably the best worst case scenario ever, isn't it? Bring business cards and copies of your CV. Bring a small notebook like I mentioned earlier and put your questions in there. Have breakfast in the morning. Some interview sites allow you to go for lunch, I think like maybe somewhere during the interview or after, or they may have breakfast, but just make sure you eat, okay? Put something in your stomach, have some food, okay, and relax. If you practice your interview questions, you will be fine. All right, I'm gonna keep coming back to that. And interact with everyone when you go. That's the best way. Like just ask. Trust me, when you make small talk, you don't try. It's not like you're trying to get to know the person right there. Like just ask basic questions. You don't need to know personal questions. It's so simple. Like how was the commute, right? Like ask them questions that you both can relate to. How was the commute? When you was coming here, right? What school did you go to? Did you go to mid year? Did you present a poster? Is this your first interview? There's so many things you can ask, all right? So just be outgoing, smile, laugh, and just show that you're happy to be there and that you're confident. Post interview, you could send a thank you email or letter. And that should do it for them. Okay? So that will be the end of this video. I hope this video was helpful for you guys. I wish you good luck on your interviews that's coming up. But please, just practice and you will be fine. Trust me. That's the number one thing that you must control. Okay, if you have any more questions, feel free to leave a comment or email me. Follow me on Instagram, Pharmacist Academy. Okay, and don't forget to hit the subscribe button if this helped you, because I'll be bringing out a lot of videos. I'm also taking suggestions for the videos. So please hit the like button, hit the subscribe button, and I'll see you guys at the next video. Peace out.